Hello and welcome. You're watching this special show called Inspire India, where we feature stories of those individuals who have gone out of their way to help those who have been hardest hit by the lockdown. Yes, you and me may be staying home, trying to stay safe, minimizing our exposure to the virus. But what about those who have been left high and dry because of the lockdown? There are migrant workers, there are old age homes, there are orphanages. Have we ever wondered whether they have got food to eat? Well, the good news is there are the do-gooders, the caregivers and the good Samaritans among us who are doing their bit to reach out to these vulnerable groups. And that's why we need to celebrate their stories and their efforts, which is precisely what we are trying to do today. These are individuals who are pulling in resources, mobilizing efforts, converging and collaborating with other like-minded individuals simply to put together an initiative and help the vulnerable groups. So let me right away introduce three such remarkable citizens of this country who have become part of such initiatives to help those who are poor and the needy. My first guest this afternoon is Mumbai-based Dr. Vinita Salvi. She's a celebrity journalist who has taken up the initiative of providing protective face shields to health workers and medical workers in public hospitals, and also catering to policemen as well with this kind of protective gear. Dr. Salvi and her team of friends consisting of doctors, product engineers, and more importantly, volunteers make these shields, and they deliver them to the respective places for health workers free of cost. So far, 16,000 such face shields has been delivered by Dr. Salvi's Shield India initiative. I welcome you to the show this afternoon. Thanks for joining us, Dr. Salvi.
Good afternoon. Thanks for having us.
Well, my next guest this afternoon is Bangalore-based Michelle Stanley. He is, in fact, part of a relief work being conducted from St. Joseph's College in Bangalore ever since the lockdown was imposed. Now, this is again a self-driven initiative of a few socially conscious individuals comprising of alumni of XLRI, St. Joseph institutions, social work agencies like Diya Ghar, Fedina, Safa, and Hasiru Dala. These are the organizations whose individuals have come together with this initiative called Karuna Warriors. The center, this particular center, has distributed 40,000 ration kits so far, which is supposedly sufficient for a family to survive for a fortnight. Now, the area of distribution include many of the slum villages in and around Bangalore. It's my privilege to have you, Michelle Stanley, with us this afternoon. Thanks for joining us.
Thank you, ma'am.
My third guest, Mumbai-based Owais Dhanji of Anfaal Foundation. Now, Owais Dhanji is working towards providing ration kits to daily wage workers in Mumbai and nearby areas. Approximately 1 lakh kilo of ration distributed in the first phase, another 2 lakh kilos to be distributed in the second phase. Now, they are covering as many as 40 areas in Mumbai, some of the worst affected areas included. Now, Mumbai, Thane and Navi Mumbai comes under their ambit. Only 4 people from their team are on ground doing the deliveries and servicing these people. The rest are all volunteers helping in distribution from their respective local areas. Ration kits includes 30 kilograms of essential food items. So my 3 guests this afternoon, of course, must be applauded for the kind of efforts they are putting in on a day-to-day basis to help out those. Perhaps there are people who the government cannot reach out to, and this is doing the job of plugging those loopholes and in fact closing those gaps which are bound to exist in a population like ours, where the numbers are huge. The number of people who need help and assistance at this point are phenomenal. So if I can come to you, Dr. Salvi, first, you are a gynecologist, and it's obviously understandable that you empathize with other health workers, with medical workers, but give us an understanding of how you mobilized this kind of an initiative, and how do you make these protective shields? Where do you make them? What does it take to go about this?
First, let us understand what is a face shield. A face shield is a simple visor which is made of a transparent material. It covers the eyes, the nose, and the mouth, and it protects the wearer. Of course, the wearer has to wear a mask, but beyond that, it covers the face so that if somebody inadvertently sneezes, coughs, protects you to a certain extent. And also, if there's a surgical
Okay.
splash, you're
I think we have quite a bit of disturbance in your audio connection, Dr. Salvi. Unfortunately, I'm not able to hear you clearly. I am not sure if viewers are able to hear you as well. So we will just try and fix that audio line. And meanwhile, if I can go to my next guest, I'll come back to you, Dr. Salvi. Apologize for this. Let's just fix the audio connection so that we can hear you clearly. Michelle Stanley, from if I can know from you your journey, how did you start this initiative? Who all are with you together in this, because I believe there is a large number of individuals, at least in your case. You operate from St. Joseph's College in Bangalore. If you can take us through your journey, how and when did this start, and what all have you covered so far?
Okay, so this was started by a group of well-wishers and a group of people, institutions, and companies together who came together. So how it all started is that, so there's this woman called Saraswati who actually runs institutions. So when this lockdown came into effect, she went into some of the villages to just distribute food kits there. And she realized that it was not only the kids there, but also the neighboring households, none of them had food kits. So that's what prompted her. But she was just one of those forerunners. She joined hands with people like Aparna, Vishal, and many other people who came together, people of goodwill, and they all together with the XLRI alumni started this off. So this is how they initiated it, and post that, so coming on to our college, how it works is that we segregate rice. We have rice and then dal and oil, potatoes and salt. So all of this are put into one kit, and then from here it's distributed to the various centers. So it's basically distributed to migrant workers and blue tented settlements, especially people who do not have access to any of this.
Right, right. Okay. All right. Again, I could only hear you in bits and parts, but yes, let's just not, shy away from saying that this is the kind of effort that is exactly required in a country like ours, where there are so many people who are thrown out of the workforce simply because of the businesses shutting. Many of these daily wage earners require food and supplies and essentials, that medicines on a daily basis. And thanks to initiatives like Karuna Warriors, who are doing their bit. And there's Oways Dhanji with us as well of Anfaal Foundation, who's also doing similar work in terms of servicing those areas which have relief camps and shelter homes. Ration kits are distributed on a daily basis. They are also operating around Mumbai. Oways Dhanji, if I can hear from you, your experience so far, which are the areas you're covering? Because from what I could see, 40 areas around Mumbai, and these are very large areas. How do you manage to cover such huge stretches in a big city and such big numbers? Share with us your story, please.
Yeah, firstly, I would like to congratulate all those who are working for the underprivileged of the society. As a whole, we have a responsibility to return something back to the society. So, congratulations, everyone. As far as our foundation is concerned, our strength is our volunteers. Our volunteers are spread across the city, and we are able to do these operations across 100-kilometer radius, starting from Palghar to Nala Sopara in the western line, and till Bhivandi in the central line. So every area is given to an area coordinator who gets the information of the beneficiaries. And then we have a central team which is taking care of taking those registrations. We have a helpline where people can call and give their details and get registered for the ration kit. Also, I would like to thank Maharashtra Police. They are doing a wonderful job. We also got the list directly from the Commissioner of Police, and we are catering to those needs as well. So this is how we are getting the information of the beneficiaries. We are procuring all the rations at a central location. We are using a graveyard to pack all the ration packages, and then distribute it and then transport it to the various areas. And then our area volunteers, they have the list, and then they provide the ration kits to the needy.
Right, and this is again commendable that there are a lot of volunteers who are helping an initiative like yours. And like you said, without these local volunteers, again, getting the material to the last person, that last mile coverage wouldn't be possible. Only 4 members are currently on ground from what you tell us, but then the rest are all people in their local areas helping out in distributing this material, something that is very, very crucial. Dr. Salvi, if you can hear me now, I wanted to know from you that when you make these protective shields that you have distributed in such large numbers, how do you procure the raw material? Where are these put together, and who's helping you in this entire process?
As you rightly said, it's slightly difficult to get the raw materials, but there are lots of friends. In fact, we are a family of more than 100 friends who are working to make these face shields. Rushad and Priyank are the technical brains, and they are the workhorses of the project. This is not rocket science. There are others all over the world, in India and in Mumbai, who are working to make these face shields. But they study the designs, we acquire the raw materials, we cut them. We cut it either manually or on laser, or it can even be cut on a die. If we need too many, we might have to go to water jet technology. But having cut them, volunteers assemble them, and then they are distributed. We have got tons of love and support from so many healthcare workers and the police as well. In fact, everybody who's worked on this project has been extremely helpful.
Right. Okay. Okay. Again, because of certain disturbances, I might have missed some parts of what you said, but I understand the effort that you're putting in, and it takes a lot of determination to see through a process of this nature where you are doing something very specific. And all of us, of course, went to our balconies and we applauded the health workers, we appreciated their efforts. But someone like you have gone to the extent of actually thinking of their requirements and not just simply throwing our hands up and saying, well, it is the government's job to provide them the protective gear. You've taken this initiative completely on your own to think about the fact that without these kind of protective shields, it's extremely difficult for the health workers to minimize exposure. They are working under very difficult circumstances. The professional hazards in situations like this are huge. And thanks to people like Dr. Salvi, who have had the kind of sensitivity to think about it and to work towards it, and also, of course, putting together this kind of equipment without depending on the authorities or the government is something that is worth appreciating. If I can come to you, Michelle Stanley, again. You have, of course, brought together alumni of many organizations who have come together. Now, I want to ask you at this point, when you cater to slums, to orphanages, to old age homes, what has been your experience like? Each of these categories would perhaps have different challenges. Let's take the instance of slum areas like Dharavi, for instance, have so many cases now. You, of course, are operating in Bangalore, but in the city of Bangalore, what are the peculiar challenges that you have when you service these kind of areas, the slum areas where the density of population is huge and there is only so many people that you can cater to? There would be so many others who you might not be able to reach out to as well.
Okay. So actually speaking, even though we are a very small number of people, we have had very great, the main issue that we are facing as of now is that when we go to distribute these kits, the people there are so many that they really come around and everyone wants to get a kit. So having a constraint of resources, we are not able to cater to everyone as such. So we have a restriction to the number of people we can serve to. That is one. Secondly is that old age homes have a different set. So we have sent rations everywhere, but we have also procured resources like biscuits, juices, and also noodles. So these are more or less given to the old age homes and the orphanages. So we look into what their needs are and we cater to them. And going into the slums is not an easy task, but we have a lot of NGOs who are supporting us in this venture. So it makes things way more easier. So that's how we work.
All right. Okay. Always, Dhanji, if you can also give us an understanding of your, how you go about on a typical day, for instance, when you have to cater to these areas, what is your SOP like? Do you follow any protocols? Because of course there are restrictions in movement of vehicles, say in the city. So when you go around these areas like you mentioned Mumbai, Thane, and also Navi Mumbai, how do you operate? Are there practical difficulties? Are there any hardships that you have to face along the way?
As I said, our strength are our volunteers. So we have a great team, and we have a great team of volunteers working on ground. So yeah, there are sometimes challenges, for example, in Mumbai area, some of our volunteers were distributing stuffs, and due to the police pressure, they were not allowed to do so for some time. So yeah, we face difficulties, and of course, we all as responsible citizens have to cooperate with the authorities because they are there for us. So it doesn't matter. Our volunteer doesn't stop there. Then after the restrictions are a bit lowered down, they go and then they do their job. So they're all dedicated. So that's the whole the main thing in the whole drill.
Yes. Right. Since you are based in Mumbai, and Mumbai, like we all know, is one of the worst affected cities across India. The numbers are really piling up. In fact, today we are reporting 1,000 cases in the last 4 days. So the numbers are clearly going to multiply in terms of the people who are impacted by this virus. So there is likely to be more containment zones. There are likely to be more restrictions rather than any relaxation, so to speak, at least in Mumbai. I would like to ask both you and Dr. Salvi, because you're based in Mumbai, to share with us your observations on the current situation and how is the city coping? Because you work on ground, many of us are confined and we don't know exactly how bad it is outside. But since you're operating on ground, Oais Dhanji, first, would you like to share your observations with us? How well are we coping with the situation, and where are we lacking so far?
Yeah, the government is doing their bit. They are cooperating with other NGOs, and of course, they have their capacity. And citizens like those who are well-wishers of the society, those who are working for the well-being of the society, have to come forward and help the authorities as well. It's their responsibility also. So as far as the medical assistance is concerned, NGOs should come forward and help the authorities. We too did our bit, and we also provided various BMC departments with PPE kits, hand gloves, and other important apparatus to deal with the situation. So if every one of us join hands, then we can definitely do something to get out of this situation.
Right. Dr. Salvi, your sentiments on this. On one hand, we are trying to break the human chain of transmission. But on the other hand, we do require a human chain of support and solidarity and coordination and cooperation, perhaps, because this cannot be done alone, isn't it? It requires collaborative effort of the government, the people, NGOs, agencies, and even individual initiatives like yours.
As I said before, there has been so much cooperation from everybody, whether it's the private sector, the public sector, volunteers. The spirit of Mumbai is exceptional. We shall win.
Right. Right, that's good to hear. And we always talk about the spirit of Mumbai, and some of it is visible on the show today with someone like you, Vinita Salvi, and Oais Dhanji. And Bangalore, of course, is not at all far behind. Someone like who spoke to us and shared with us her experience on starting an initiative to help the poor, the needy, those who have been left in a rather difficult situation. It's time that we all step up with our efforts if we can in a similar way. It doesn't really take much. Perhaps one person takes a lead and the other individuals do come forward. It's just about sometimes taking that initiative like all three of you have done. I really appreciate your efforts, salute your courage and your determination to do something like this for society out of pure humanitarian concern. Thanks for joining us on Inspire India, and thank you for sharing your stories with us.